Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then investigations of post-streptococcal glomerulonephritis. In post-streptococcal glomerulonephritis, the best initial test to do is a urine analysis. On urine analysis, you will see presence of hematuria is seen on urine analysis mainly, and you can see azotemia also. Then but the most accurate test to be done is actually a biopsy, but this biopsy not it is not usually done because it is better to give a course of antibiotics and course of disease, treatment should can be given even if it is suspected without a biopsy. But there might be some conditions where biopsy is indicated. So indications of biopsy in post-streptococcal glomerulonephritis include if the patient has history of prior hematuria, or if there is no improvement of the cases is seen within 2 weeks of time, or if the complement levels of the patient are decreased. So they are decreased, that is if C3 and CH50 are decreased. In such cases, we should do biopsy. And if there is actually the complement levels are decreased in post-streptococcal glomerulonephritis, but they become to normal within 6 weeks. But if there is persistently low complement levels, if there are persistently low complement levels even beyond 6 weeks, then we can give post then we can give we can do biopsy in these cases. Then recurrence is very rare in post streptococcal glomerulonephritis. Immunosuppressive treatment is not recommended.
thank you and thank you for watching.